In the 1930s, during the Great Depression, the U.S. government created the Homeowners Loan Corporation, and they began mapping neighborhoods and used color coding to identify how risky they were. Neighborhoods with black residents, regardless of income, were marked in red and labeled risky. This practice, now known as redlining, was a federally sanctioned tool for racial segregation and disinvestment. It determined who got access to opportunity and who was deliberately shut out. Redlined neighborhoods were starved of investment. Banks refused loans, businesses stayed away, and cities diverted resources elsewhere. So while white families used federally backed loans to move to the suburbs with new schools, clean parks, full-service grocery stores, and modern hospitals, black families were trapped in neighborhoods systematically denied access to those same investments. Over time, grocery chains followed the money to the suburbs, and supermarkets in redlined areas largely disappeared. By the 1970s, many black neighborhoods had little access to fresh produce, but they had plenty of access to fast food and corner stores selling ultra-processed snacks, alcohol, and tobacco. This is how redlining created what we now call food deserts, or more accurately, food apartheid, because the lack of access is the direct result of policies rooted in racism. But it wasn't just food. These same communities had fewer hospitals, fewer doctors, and when there was easy access to care, it was often under-resourced, overcrowded, and unaffordable. These are called healthcare deserts, another legacy of redlining and structural racism. Today, research consistently shows that people living in these neighborhoods are more likely to suffer from chronic diseases, including diabetes, hypertension, asthma, and kidney disease. And their life expectancy is on average 5 years shorter than people living in areas that the government once labeled as favorable. And when people in these communities do seek care after being disproportionately impacted by chronic disease, they often face medical racism. Black patients are less likely to receive adequate pain medication, more likely to be misdiagnosed, and less likely to receive life-saving care. A 2016 study found that half of white medical students and residents believed myths like black people have thicker skin or that they feel less pain. A more recent study found that black people living in counties with more black primary care physicians live significantly longer. So yes, I do hear myself, because there's an immense amount of evidence if you're not choosing to ignore it. In the history, in the data, and in the lives of the people still living with the consequences. Racism isn't just individual bias or hateful language. It's embedded in the policies that determine where people can live, what food they can buy, how far they have to travel to see a doctor, and how they're treated when they get there. If we want to improve health for all Americans, we can't ignore the root causes, and in America, racism has always been one of them.